Hi guys, thanks for joining us on our talk. We are getting down to the dirty. I am Dr. Rena Malik, a urologist, and this is
Sonia Bahlani, a GYN.
And we are your dream team for down there. So the bladder, pelvic floor, and vagina. We're going to teach you today how to optimize your quality of life, and make sure you stick around to the end because we're going to talk about some really interesting stuff about how to get your sex life back to the way you want it. So we're going to start by talking about the bladder.
I love this. So Rena, tell me a little bit more about kind of what you see in your office when someone comes in, like your typical patient.
Yeah, so I see a lot of patients with urinary incontinence or leakage of the bladder, and that can be due to a number of different things, but the most common things are having this sensation that you gotta go, and you can't make it to the bathroom, and so you have incontinence or leakage because of that, or you have incontinence because you are lifting something heavy, bending over, coughing, exercising, those sorts of things. And then conversely, the other thing that I see a lot of is they don't have incontinence, or they may have it, but they also have a lot of urgency and a lot of frequency, meaning they're going to the bathroom a lot during the day. They are having that sensation that they can't hold off going to the bathroom, and they're waking up a lot at night to urinate, which is really a big problem for a lot of people.
For sure. I mean, I can only imagine how common that is. But and so since we're doing this, focusing on the South Asian population, do you think it's relatively common in the South Asian population? Do you see it a lot?
Yeah, it's actually pretty common. I see a lot of South Asian women who have both of these problems and, come in for incontinence. And I think the saddest part about it is they wait for so long before they come see me, and they've been dealing with it for so many years because as South Asians and women in general, we tend to take care of everyone else around us before we take care of ourselves.
That's such a good point. I know. I see the same thing in my own clinical practice. So, kind of getting down into it a little bit more, what are some of the causes for this stuff? Is it like a problem with the bladder, the muscles? What do you normally see?
Yeah, so when you have a problem with the urinary tract, it can be a problem with the bladder itself, which is what holds our urine. So the bladder itself can have overactive contractions, and you can go before you're ready or have that urge before you're ready. Or it can be a problem with the outlet, so where you pee from, and that's called the urethral sphincter. And so there can be weakness in the urethral sphincter that causes you to have some leakage because you can't hold urine in. So it's not as much of a problem with storage, it's a problem with being able to actually hold the urine in. And so both of those problems can happen independently, meaning you can have one or the other, or you can have them both at the same time. And so depending on what problem you have a different set of treatment options.
That's great. And in terms of treatment options, I'm sure it's hard to kind of go down a slew of things, but just in general, can you kind of tell me, is it medications? Is it surgery? Is it lifestyle modifications? Where do you go? How do you navigate this?
Right. So there's actually a pathway, and there's you can do things very naturally and all just manage with behavioral changes. There are medications if you are really struggling, and then there are procedures that you can do. And it depends again on the type of incontinence you're having. But I think for the most common thing, as I tell all women, is that you can watch what you're drinking. So you want to drink enough that you're hydrated, but you don't need to overdrink. So you don't need to walk around with a big Yeti full of water all day long because you're going to be rushing to the bathroom all the time. So you want to drink when you're thirsty. My kind of recommendation is drink whatever you want during breakfast, lunch, and dinner. And then in between, just have a little 16-ounce bottle of water and sip on it throughout the day. But you don't need to take these big gulps of water. Also, yes, I got mine too. No, but that's coffee, which brings me to the next thing is that in South Asian culture, we drink a ton of chai, and now younger population drinks a lot of coffee, and all that stuff is a big bladder irritant. So actually it sensitizes the lining of the bladder and makes it more likely to contract, which gives you more urgency. So if you're drinking a lot of chai or coffee, you may want to cut back. So you might want to try drinking 1 cup of regular coffee and decaf if you really love it, or drinking decaf and, trying to play around with it to see if it can improve your symptoms. The other thing I tell everybody is watch your constipation. So the pelvic floor has a bunch of organs down there. So there's the bladder, the uterus, the rectum, and the pelvic floor muscles. And so if one of them is bothered, all of them can be bothered. And so if you're constipated, it's pushing on the bladder, causing a lot more symptoms. So really manage your constipation. And there's a lot of ways to do that. You can do natural things like eating apples and prunes and adding fiber to your diet, or you can try to do things like Miralax or stool softeners, and those things can help as well. And then weight loss is a big issue as well. So if you lose weight, there's good studies to suggest that you will improve your bladder symptoms, and particularly incontinence by losing only 8% of your body weight, which is not a lot. If you lose even 8% of your body weight, you will see an improvement in your symptoms. So those are things, yeah. Those are things I tell everybody because I think they're super helpful and I think they make a big difference. And then lastly, if you're smoking, quit, because smoking is a huge bladder irritant. It's horrible for your health, obviously, and also is a risk factor for lung cancer and bladder cancer. So I think in general, smoking is bad, but it's also a bladder irritant. So it can cause the same issues as caffeine. And it can cause you to have a chronic cough. And so when you have a chronic cough, you're putting more pressure on the pelvic floor and you can have more leakage.
That's great. Yeah, I love that explanation. Now, I just want to delve a little bit deeper because I think it's so interesting with the chai, because my mom does this. She always has chai like in the morning, and then around like 5 o'clock, she needs her second cup of tea. What other things can people be putting into their bodies that are considered bladder irritants?
Yeah, so there's a lot of things, and I think that there's not a ton of good data on this, unfortunately. The good data we have is on alcohol and on caffeine, and both of those things we have good data on. But the other things are kind of, you have to pay attention to what you're eating and or drinking and how it impacts your personal bladder. So I tell people, if you have a lot of one of these things, try to eliminate it one at a time and see if it improves your symptoms. And if it doesn't, then put it back in your diet. So these can be artificial sweeteners for some people. This can be spicy foods for some people. It can be also acidic foods. So any sort of juices, tomato sauces, tomato-based products, those can irritate the bladder. Yeah, so those are the big ones that I usually tell people to kind of look out for first, of course, with alcohol and caffeine. And then also watching, if you're drinking chai late at night and alcohol, both of those are also diuretics, which means they make more urine than you're actually putting in to your body. So if you drink 8 ounces, you're going to make more than 8 ounces of urine. So that also increases your urinary symptoms or needing to go to the bathroom more often. So those things, in general, you want to watch how much you're drinking, and definitely before bedtime. So I also tell people who are waking up a lot, stop drinking a couple hours before bed. If you need to take a pill, take just a sip of water with your medication before bed, but try to really limit that fluid intake before bedtime, and that can really improve your nighttime.
That's great. Yeah, I tell my patients the same thing. I say, really try to limit what you're drinking. And I usually say 3 o'clock. Not that I think that 3 o'clock has some magic time to it, but just that people tend to like get home and then chug a bunch of water or whatever it is. You know what I mean?
Yeah.
And I found I thought that was super interesting about the weight loss. So how is that affected? Is it because of the pelvic floor, or like what is that association there?
Yeah, so we know that it actually helps both types of incontinence. So the urgency as well as the stress incontinence. Stress incontinence makes a lot of sense, right? If you have more weight on your pelvic floor, that's more strain on your pelvic floor, which is already weak, so you're going to have more leakage. So when you reduce that weight, you're going to have less leakage. As far as the urgency part of it, I mean, it's just you're kind of, in general, reducing the strain on your body. You're probably improving what you're putting in your body as well. So there's a lot of different factors with that. But in general, I think weight loss is great for a lot of medical problems, and it makes you feel great. So there's really no downside to trying to really commit to losing weight.
For sure, yeah. And I see it a lot even with my pelvic floor patients with pain. I mean, that weight on the SI joint and in those areas can definitely exacerbate symptoms, even lower urinary tract symptoms, like you're saying. And for the people who kind of are out there and are like, I love how, by the way, you like focused on a global picture and lifestyle modifications, because this is all important stuff. It's the little stuff that makes a really big difference, I think. Mm-hmm. But for the people that are like, I just want to fix this. Like, I just want, can you do surgery? Is surgery a thing for this? And if so, like, does it normally help significantly, or what are your thoughts on that? Because you're a surgeon.
Yeah, for sure. So I think well, I'll talk about it in two separate ways. So for the urgency incontinence or the gotta go, can't make it, there are medications that you can try. And then if the medications don't work, there are procedures that you can do. And these are actually quite effective. So two of the ones that are about 80% effective are Botox injections in the bladder. And they're really simple in-office procedures. So you don't have to go to sleep. And you're numbed, and so it's pretty, reasonably like not hard to go through. And you get Botox in the bladder, and it's about every 6 months to a year that you come back to get more Botox in the bladder if it works well. The other option is called a bladder pacemaker, or sacral neuromodulation is the fancy term for it. But essentially, what it does is it stimulates the nerve that goes to the bladder, the pelvic floor, and it normalizes kind of that function of the bladder so that you have less urgency, frequency, and urgency incontinence. And it is an implantable device, but the nice part about it is there's a trial. So you come into the office and we do a trial for you for the first week, and we see, does this even work before you have to go through surgery? So you get to see firsthand how your symptoms are going to improve before you go on to do anything, major or maximally invasive. And then the last option is called PTNS, and that's basically based off acupuncture. So it's an acupuncture needle that goes into the ankle, and it stimulates a nerve that goes to the bladder, but it's a little further than the bladder, the nerve that stimulates the bladder with the pacemaker. And so the nice part about it is there's literally no downside to it, except for it takes time. And so you have to come to the office once a week for 12 weeks for the first, to see if it's going to work. And then at about 6 weeks, you kind of figure out if it's helping you or not. And you finish the 12 weeks. And then usually there's a maintenance regimen, which there's no good data on exactly what it should be, but it can be 1 month. And then you can kind of slow it down to every 3 months. But, I've said people who do it, they do definitely get relief of symptoms, but it is that time commitment that's challenging for some people. I think the interesting part, there are studies where they are coming up with new implantable devices in the alongside that nerve. So that may be something new and exciting coming for overactive bladder and urgency. As far as, yeah, go
The
ahead.
posterior nerve, you're saying, right? Like that's
Right. Yes.
Well, we've looked at that for IC patients. Like you said, really helpful for the urgency frequency, but not so much for the pain. So interesting. And now they're that's cool. I didn't even know that was the next step.
I'm curious, have you found that the sacral neuromodulation helps with your IC patients?
For patients whose primary symptoms are urgency frequency and not pain with bladder filling, yes, for sure. But when the pain with bladder filling is really their primary complaint and the urgency frequency is more of the pelvic floor picture, then not so much. So I think, like you're saying, it's like picking the right patient. You know what I mean?
So I think we're getting a little ahead of ourselves because I don't think everyone here knows what IC is. So maybe you want to tell people a little bit about IC and what exactly that is.
Sure. Yeah. So a lot of what I trained in focuses on this term called interstitial cystitis, which really doesn't mean anything. So we now call it bladder pain syndrome. And then it changed before that from painful bladder syndrome to bladder pain syndrome. So like all these names for it, right? So, but what is it? So it's really where patients present with symptoms of urgency, frequency, so lower urinary tract symptoms, but the key concepts or the key thing that you have to remember here is that they present with pain with bladder filling. So they're like, I got to go to the bathroom. And then when my bladder's full, oh my God, that pain, I can't tolerate it. And it's not even like just the urgency like you described in some of your overactive bladder patients. It's an actual distressing symptom. And a lot of times what they'll say is, I think I have a urinary tract infection. And so they end up seeing urologists and GYN and saying that I have these recurrent UTIs. But as we both do in clinical practice, their urine cultures are negative. So now they end up being treated with all these antibiotics, but that's really not the issue here. Do you know what I mean? It's not actually these recurrent UTIs. It's actually something known as interstitial cystitis or bladder pain syndrome. And that's really where there's a disruption in that lining of the bladder, like you said, that gag layer of the bladder, or the glycosaminoglycan layer. So think of it like a protective coat. And now there's little holes in that coat. So it's kind of like leaky gut of the bladder, so to speak. And so that's why the patients will say when they eat certain foods, like some of the foods you described, acidic foods, spicy foods, caffeine, that pain gets worse. But it's such an interesting entity because not a lot of people study it. And then also not, it's oftentimes associated with other pelvic pain syndromes. So things like pelvic floor dysfunction, vulvodynia. And so there are so many people out there that don't even realize that they have this. Do you know what I mean? Because they just think they have recurrent UTIs, or they think they have overactive bladder. You know what I mean? Like they don't put the pieces of the puzzle together. So.
Yeah, I think it's really important to understand like the pelvic floor, which is the muscles and ligaments that hold all of our organs in, like the bladder and the rectum, and those are really an integral part of our anatomy, and so they can cause a number of symptoms, and they can actually cause some of the incontinence we talked about. So they're helpful for the stress incontinence, like the leakage when you cough, sneeze, lifting heavy things. So doing exercises like Kegel exercises with and without a therapist can help those, but they can also, in some women, be like really tight and really what's called high tone pelvic floor. And you will never even know it. It's like, I kind of tell people it's like TMJ, where it's really, really tight all the time, but nobody knows. And then when you examine them, they're super tight, and you realize that if you treat this with some physical therapy, it can actually help all the symptoms you're having. So it's really important to see a specialist that can identify this when you're having any sort of incontinence, so that we can help you figure out what the best treatment is for you.
For sure. I always tell patients, how it's associated, because it's so interesting. Because like you look at you see my little pelvic floor figure, but the bladder contracts, and normally the pelvic floor should relax. Like you said, the outlet, the pelvic floor should relax and you should empty. But with high tone pelvic floor dysfunction, what happens is the bladder contracts and the pelvic floor actually tightens. So you don't completely empty. And that's where those symptoms of frequency, persistent urgency, I gotta go, like you said, can also relate to incontinence. And so key what you said, which I like totally agree with, is the TMJ thing, because no one realizes this, but you can hold stress in your pelvic floor. So have you ever had like those patients that come in that are like, I have to go to the bathroom, and when I go out, this symptoms worsen. Like I'm not sure, maybe I have a shy bladder or something. No, what are you doing? You're holding that tension in your pelvic floor just like people hold it in their jaw.
Yeah.
And pelvic floor physical therapy is great, but there's also like, we could put Botox into the pelvic floor for people who have, real issues with things like vaginismus and really unable to relax those muscles themselves, because muscles have muscle memory. So like, sometimes you can do all these things, but they just go right back to that contracted state.
Right.
And I love how you talked about Kegels. Like, Kegels have like the best PR, okay? Because like everybody is like, I want to do Kegels, but Kegel, like you said, Kegels are sometimes not the right thing to do for someone with a hypertonic pelvic floor, because that can actually worsen your symptoms. So you want to do reverse Kegels for that. But then for your stuff, you actually want to do Kegels.
Yeah, so it's really, I think we're giving you a lot of information, which can get a little overwhelming, but I think ultimately what we want to really get across to you is that if you're having any of these symptoms, that we can help you figure out exactly what's wrong with you and help you get better, rather than wasting time trying to figure it out at home or doing Kegels. And are you doing them right? I don't really know. Come see one of us or anyone near you, and we're happy to help you find somebody if you live anywhere in the country. We know people all over the country, and we can help with that. But I do want to talk a little bit about pain with sex and how we can improve our sex lives too. So Sonia, can you tell us a little bit about, some of the things you talked about, like pelvic pain, and what you do for that?
Yeah. So there's so many different causes for painful sex. And I think one of the biggest things is sitting down with someone and saying, let's break it down. And that's often a conversation that I think people can be reluctant to have, but they shouldn't be, because sex is an important part of our health. So certain causes of painful sex can be something known as vulvodynia, where you have a lot of pain with initial penetration, and that can be due to a multitude of reasons. So vulvodynia can be due to hormonal reasons, it can be due to inflammatory reasons, it can be due to what we call neuroproliferative reasons. So breaking that down is key to kind of get your life back. And then, of course, as Rena said, the pelvic floor is a part of the issue too, right? Because if it's tight and it has these contraction knots in it, penetration is going to be really difficult, especially deep penetration. And then with IC as well, because if you have pain in the bladder and anything hits that bladder, you're going to have painful sex. So there's so many different ways we can approach this.
Yeah, and I think how often would you say that by some of these treatments you're offering, your patients are able to have normal sex on non-painful intercourse?
I would say generally, I say 99% of my patients have a normal life. I mean, like, there are so many things we can do and so many different ways to approach it. And I think that part of the reason our conversation is so important today is kind of understanding all of the different factors that can play a role in your symptoms. And if you have a doctor like us where we can diagnose the multifactorial causes and deal with all of them at the same time, that's really when you just can live a normal life. So I would say if you have any of these issues, you absolutely should see someone, because you could be 100% better. You know what I mean? And I believe that, and I see that. Don't you think? Do you think so?
Yeah. I mean, look, I think the important thing, yes, you can absolutely get to 100% better, but it's going to be a work in progress, and you're going to try certain things and they're not going to work, and some things are going to work because it's an individualized process. It's not a one size fits all. And there's no perfect test to diagnose exactly what's wrong with you. Right. So, a lot of my patients, I'll do multiple tests on, and I think it's just like understanding that we're going to work together. We're going to get you better. We may not, like for bladder symptoms, I can't promise I'm going to get you perfect. Right. I think there's a lot of factors that I can't control, but we can get you better to a point where you are happy, where you can go to the movies, where you can go outside without worrying, where you can travel and like in a long car ride without have to stop 10 million times, and you can have good, enjoyable sex. So I think like those are the goals, and it's really about talking about what your biggest expectation is, like what you want out of your doctor and how we can get you there, and just understanding that it's going to be a process and trusting us that we're going to help you get there. And that's so important because we want to help you. We want to be there for you.
For sure. Yeah. And like you said, this is all quality of life issues, right? But people don't realize that quality of life issues are huge issues. And so 100% it's important to get them evaluated, to say the least, and to do your due diligence, because you don't have to live like that. And I think that that's key, because some people will just be like, it's fine, I'll just go to the bathroom and go again, but it ultimately will affect you, and ultimately it can just play a role in so many other aspects of your life. So I also think a lot of people don't realize that there's specialists like us that exist out there. Do you know what I mean? They're just kind of like, oh, okay. And so I think this is key.
Yeah, exactly. A lot of primary care doctors will be able to give you some basic knowledge, but they have to take care of your whole body, so everything about you. So they don't necessarily have a lot of time to focus on these quality of life things. They need to make sure you're not going to die of a heart attack, which is equally important, if not more. But these things matter a lot, and we just want you to know that there are things you can do. What can women do at home who are experiencing pain with sex? What are some things that are easy for them to start trying to do?
I definitely think one of the first things that are super important is to make sure, and this is not going to fix everything, but like we said, there's some lifestyle modifications that are key. One, using a lubricant. It's kind of simple. It's nothing huge or life-changing, but using a good lubricant can be key to helping with discomfort with initial penetration. Understanding that not all lubricants are made equal. You really want to take a look at what's inside each of your lubricants, and exploring with your partner. I mean, I know that sounds crazy to some people, but it's not. But really utilizing different lubricants and seeing how you work with them. Constipation is key too for patients with painful sex, because exactly like constipation is related to incontinence, it's related to the hypertonic pelvic floor with pain as well. So it's important to make sure that you're not constipated. A second thing that's kind of interesting is yoga. There's data behind yoga and meditation for hypertonic pelvic floor dysfunction. Aside from the fact that yoga kind of decreases your cortisol and that kind of thing, it lengthens your muscles, right? You're stretching, you're lengthening, you're not shortening. So that is oftentimes super helpful. And then meditation in general, anything where you're not holding stress within that area and you're actually acknowledging it, deep breathing, diaphragmatic breathing, releasing those muscles is key. And they're just small things that you can do, but they can be super helpful.
Yeah, I'm a big believer in meditation, and just kind of managing your stress in life can go a long way for so many ailments and health problems. And so, whatever that is, meditation, yoga, but really making time for yourself. And I think that's the key. It's like we feel selfish sometimes taking that time for ourselves to do a yoga class or go meditate, or like not cooking dinner, or whatever it is we need to do. And we're like, hey, I'm going to go to the gym. But if that helps your stress level, make it a priority, make yourself a priority, because you deserve it. Like, you've worked hard and you're worth it. Like, just go for it, I want to talk a little bit more about the lubricants though. Tell me, what should people be looking for in their lubricants?
So you want to make sure that there's no parabens and sulfates, and that's kind of dermatologic, right? I mean, you do that in your own facial products, so why would you not do it in your lubricants? There's different types of lubricants, water-based, silicone-based, and we all have our own preferences. Water-based lubricants are probably the most popular. They're probably the least irritating, but they're nice because they're easy to find and easy to use. But silicone-based lubricants are sometimes what people would call more fun. They're more slippery. They last longer. They are kind of like the consistency of them is very different from a water-based lubricant. And so there's some great silicone-based lubricants out there that are organic and healthier, so to speak. And then, we could always go into this vaginal microbiome thing. So why does it matter? Because there's bacteria in your vagina, there is anywhere. And you want to make sure that it stays healthy even during intercourse and that kind of thing.
Right. And what about, what can you find in your kitchen that you can use if you don't want to go to the store and buy some lubricant?
So coconut oil is a good thing. People always ask me about grapeseed oil. It's pretty good too if you want to use natural oils. And something that people don't really use, but actually a lot of our medications are based on it, Crisco.
Yes. Yes.
So it's, and not the oil Crisco, it's actually the baking lard Crisco. Do you know what I mean? And it's a great lubricant.
Yeah. Yeah, I've heard olive oil too, which is a little messy, but that can work as well. So you can literally go into your kitchen and find something. And sometimes, the olive oil and coconut oil have some anti-inflammatory properties as well. So it can be used if you're having some vaginal dryness, things like that. I mean, it can help in a lot of different ways. So don't be embarrassed about doing things for yourself. Like, just go out there and find what you like. And there's no harm in using it, even if you are, don't have any issues with dryness or anything. Like, lube is great. It's going to help improve your sex life.
For sure. Yeah. Even young patients, everybody.
Yeah. What about warming and cooling lubricants? Do you recommend those?
You know what? I don't, only because oftentimes they have certain products in them for my patients that can be irritating. I am a huge fan of lubes that basically, and because lubes that are organic, and I don't like to use the word organic because then it seems like it only has to be organic, but I mean like less is more, has less products in them, and I think that they work better. And then, there's also the advent of CBD lube. And so everybody wants to know about CBD lube. That's all the rage these days because there's some data on cannabinoid receptors in the vagina, and I think in the bladder as well.
Yeah.
And so there's interesting CBD lubes out there that people enjoy and work for them. And then aloe-based lubes are the other new big thing that people, because of that cooling, that can be super helpful as well.
Yeah, I think the thought behind temperature-based lubes are they're stimulating different parts of the spinal cord, right? The spinal cord has like touch receptors, vibratory receptors, and temperature receptors. So for some people, they can be really pleasing, and they can really enhance your sexual experience. So yeah, I think you can use them, but you have to be careful about what's in them for sure.
Yeah. And I think using them for the right, like we're saying this whole time, for the right person. Like if you're having pain with initial penetration, those lubes are going to irritate you more, only because if you're already feeling burning and they cause more heat, you're going to be like, this is painful, But if you're not having those issues, then for sure they are a good option to explore.
Yeah. What about orgasms? How about women who are having issues climaxing.
Yeah, there's so many different levels to orgasm, arousal, and sexual health, as you know. So there's lifestyle modifications that can be done. So part of the thing with patients who have hypertonic pelvic floor, vaginismus, or tight pelvic floor muscles is that there's decreased blood flow. So when there's decreased blood flow, it becomes harder to orgasm. So sometimes just treating the problem helps with orgasm. There's also, lubricants are also helpful for orgasming. And then there's also like topical plant-based oils that people try. There's off-label medications that we use often. But I think the take-home point is that orgasms are natural. Orgasms should happen in every patient. And I have so many people who come into my office, I'm sure you see this too, they're like, I just thought women don't orgasm. That's not true. And you should orgasm, and it's actually healthy to orgasm. And if you're not, you should see a doctor, because there's so many different ways we can facilitate this to happen for you.
Yes, yes. And I think the other thing to realize in women is that sometimes vaginal penetrative intercourse, in fact, most women don't have orgasms with vaginal penetrative intercourse. You need some clitoral stimulation or things like that to really achieve climax. And so you're not abnormal if you fall into that category of 80% of women. That's a very normal thing.
For sure. But even with penetrative intercourse, because clitoral stimulation is key as well. But for patients, there are patients that can orgasm from just penetrative intercourse. And if you're not and you want to, we can do something about that. You know what I mean? And I think that that's key. And it doesn't have to be a medication that you have to take every day. I mean, there's off-label uses for even things like oxytocin. You know what I mean? Like there's so many different ways to try to get you there.
Yeah, for sure. And what about toys?
I know, and you have to help me with this question. Oh my God, so many toys. Let's see. So I'm a huge fan of vibrators, because I think that they're key for women exploring their bodies, for understanding, just like Rena said, what stimulates you. Because for some women, it's going to be clitoral stimulation. For some women, you can actually have a cervical orgasm. Do you know what I mean? And so why not explore? A vibrator is a great option to explore. And you can get a really expensive one, and you can get a totally not expensive one. And they all work great, especially with lube.
Yes.
What's your favorite toy?
Yeah, I like just a plain old, simple small vibrator that you can use kind of all over. And I think it works great, and it's not super expensive, and I use lube, and I think I prefer silicone-based lubes. I think they work great. And so, yeah, I think I think every woman should have one. And if you don't have one, or your best friend doesn't have one, go out and buy them one. Go out right now, go on Amazon, get it right now.
And it was so funny when you and I first had this conversation, we're like, okay, we're going to do this. And then we were like, South Asians don't like talking about sex, although we wrote the Kama Sutra. You said that. And I was like, yes, right? Like, as a part of our culture, like, this is back in the day something that was so important, and all of a sudden it's absolutely stigmatized. So it's funny to see that not funny, but that transition is crazy.
Yeah. I mean, look, I think we need to open up the conversation, and so talk about it with your friends. I think that everyone is dying to talk about sex, but they just don't know how to broach the topic or feel uncomfortable. And you shouldn't, right? This is like a normal part of your life. In fact, it should be a very pleasurable and enjoyable part of your life. And so the whole goal of this talk for you guys is to make sure that you guys know there are options for you, that this is appropriate and normal to talk about, and okay to help yourself and see a doctor when you need to.
For sure. That was great.
Awesome. And so if you guys leave some comments on in the chat box, we'll maybe try to do some follow-up or something, because this is obviously a pre-recorded talk, but let us know if you have some questions, and maybe we'll try to do something for you guys later down the line. Sonia, can you tell them where to find you?
Yeah. So you can find me on Instagram at Pelvic Pain Doc. You can find me on my website, which is www.pelvicpaindoc.com, Twitter and Facebook, all the same handle.
And she has a practice in New York City. So if you're looking for a doctor who deals with pelvic pain, make sure you check her out. And you can find me on YouTube, Twitter, Facebook, Instagram, all at Rena Malik MD. And I practice in Baltimore and Columbia, Maryland. So if you need a urologist, happy to help.
Awesome. I love it.